Welcome to the 2023 Global DEI Conference, a groundbreaking event presented by Ludo and One Business World, dedicated to reshaping the landscape of DEI. We are having transformative presentations to generate actions to be part of this global movement for an inclusive future. I'm delighted to be joined now by Paul Hackett, who is the founding partner of the Wellbeings. Paul, over to you. Thank you.
Elizabeth, thank you very much indeed. And good day, everybody. Thank you to Stelios and the One Business World team for their support and help in getting us here. Very, very quickly, I know it's unusual to start a presentation with an apology, but I would like to very quickly apologise. If anybody has searched our holding site, you will have seen something terribly historic. It's completely our fault, but much has evolved since that early day about a wee while ago. So what I'm about to do is share with you a more contemporary insight into what it is that we're up to. So let's take a look right now. So who are we? We're a collaboration of doctors, behavioural scientists, chief wellbeing officers, and brand marketeers. And we're here by dint of a serendipitous meeting that took place between a paediatric surgeon and myself, a paediatric surgeon from Great Ormond Street Hospital. And Great Ormond Street, for those of you who don't know, is the Children's Hospital in central London that's part of the University College London Hospital Trust. And it was a discussion with him about helping on actionable innovation projects that actually brought the group of us together to where we are today. So I'm going to carry on through and take you to that story. By dint of our advertising and marketing background, we of course went away, having spoken to Neil Bulstrode, the surgeon, and started investigating consumer behaviour behind this thing called healthcare consumption. And these are just a few of the top line statistics that really caught our eye and to a certain extent, I think, made us rethink not just what it was that we were doing, but also the relationship that we have with public health, healthcare services design, and crucially, and frighteningly, the path that we as a nation were on as we dug deeper into consumer behaviours and the insights that kept coming to the surface. Statements such as this became something about our motivation. So our purpose really is to help non-healthcare brands behave more like healthcare brands. And by that we mean, how do they establish and identify and understand their positive well-being impact on colleagues, employees, customers, and community? Because actually, as non-scientists, the deeper that we stepped into the medical and clinical community, we found to, perhaps this is a naive statement, just how siloed so many of the specialties and research projects and even practices still are today. And actually, it was that separation, that isolation, which has ironically meant that well-being has become a topic that is still most often addressed when we think in terms of illness rather than positivity and the future. Now, this overly busy chart, I do apologise, I wanted to include to show members of the audience that in fact it is possible to enter the realms of well-being in as holistic and as complete a manner as possible. As I say, it may sound a little naive, but we wish to try and understand where the imbalances might be and how we might address them. So company employees, leadership, consultancy when it comes to the products and services and behaviours of those organisations, how we use media today, and there's an interesting side comment on that I'll make later, and the increasing innovation in medical science. How do we bring those together to make it a commonplace discussion, a commonplace set of behaviours, rather than something, as I say, that we turn to when things seem to be going awry? Now, when I say awry, this is, forgive me, but it's a very UK-centric perspective, but it's something that I hope enables you to understand how we set our minds about this task. You will know already that genetics, environment, and behaviours are the things that account for perhaps 70% or more of our health status. However, if you look at the UK as a nation, as an economy, there are now more people over the age of 50 leaving work than there were in 1970. And just over 90% of those people who unfortunately lost their lives by dint of COVID-19 were already, by medical definition, in some state of poor health. And when we look at women's health in particular, and I'll explain our focus on women's health when I talk a little bit more about the UCL Institute of Women's Health, one of our collaborators. In a healthy Western economy, typically women suffer their first major health condition in their mid-50s and beyond. But when you look at more socially deprived areas, that 55 is actually closer to 47 or younger. And that's in the 21st century. Now, importantly, there are some 19 or more million people currently being cared for either in hospital or in community who suffer from a chronic illness, that's to say a long-term illness. That is a fraction over currently 28% of the UK population, not adult population, our total population of around 67 million individuals. But again, as you can see from the World Health Organization on the left-hand side of the chart, those few lines there will tell you that well-being, health and well-being, and discussion about it is about cure and hopefully improvement. Whereas we feel very strongly that in the 21st century, the opportunity that presents itself right now is to talk about health creation. And crucially, one of the key players in the development of health creation are organizations, employers, and brands. They are not the hospital or the local GP. So why well-being driven? Essentially because, as you can see from those figures, well-being isn't binary. Environment, social context, behaviors, all of these things bring us together to present ourselves as our current state of health. And more importantly, this notion of the role of brands, and I don't think this is necessarily UK specific, but it certainly applies to us. There is a great deal of research that suggests that as consumers, not scientists or doctors, but as consumers, we look to our chosen brands and those organizations with which we have some kind of affinity and see them as more trustworthy, more reliable than our government. It's very, very, very likely that in order to be well-being driven with a D, we're only going to achieve that with the integration of organizations, of brands, and media too. Now, you won't be surprised to know that there are a great number of expert bodies who've been predicting this for some good while. I won't read out its quote, but it is something of a famous quote from the 2016 World Economic Forum. Interestingly, in 2017, in fact, on the 20th of April 2017, Fortune magazine featured the word COVID on its front cover for the first time. So again, the notion of the difference between, I should say, responsiveness and proactivity comes to the fore, even more importantly. By 2020, business leaders, senior commentators were telling us that actually, when we used to think about ourselves as a digital economy, we now need to think more closely about how we align our behaviors, our objectives, our ambitions, and our outcomes with being a health business. And that's the thing that's behind our notion of what well-being driven looks like, because this is where it brought us. A very, very typical magazine ad from the 1950s on the left-hand side, but actually it was during the 1950s that every major Madison Avenue advertising agency had an in-house psychologist. it was as early as that people were recognizing in order to build an impactful and meaningful strategy, we need to understand more about the human psyche. The panel on the left is where we're at now, 70 years on. And as you can see from the last few lines, we have collectively come to a point where we believe every organization needs and can benefit from the inclusion of a well-being driven impact strategy in the way that they plan behaviors, business, and their future objectives. So what does this look like? Well, we are active contributors and members of something called the King's Fund, Ideas That Change Health and Care. And for those of you outside of the UK, the King's Fund is a London-based foundation, I think first put in place by King Edward. So it's been around for a good while. But its funding does a number of things. It brings together thinkers, doers, change makers, and experts who have a framework by which we can share evidence and ideas that we think may positively impact and improve the nation's health and care. So well-being-driven isn't this list here. This may seem a little bit infra-dig, and I know it's incredibly easy to be an armchair critic, but increasingly as non-well-being experts, we found ourselves, when we spoke to well-being experts, too often discovering that health and well-being is seen as either, if not a one-size-fits-all, then something of a sticking plaster, which once in place is doing a great job. And in fact, that can't be further from the truth. And the one line up from the bottom of the chart, there's a reference there to wellbeing champions. Now I happen to be, for the past 3.5 years, a trustee of a mental wellbeing social enterprise. And our learnings have shown us that where organizations have in place figures such as mental health first aiders, which is a fabulously progressive step to take, the only downside is first aid, much like insurance, is something you call on when things go awry. A well-being champion, be that mental health well-being champion or more general health well-being champion, is someone who throughout the course of a year is consistently trained and supported to be the conscience of an organization, to help with not just planning, but also reviewing outcomes and performance of an organization when they say, we will do the following over the next quarter on behalf of, let's say, employee well-being, and then be able to look back at the end of that quarter and say, did it have the outcomes that we were hoping for? And if it did, what does the next quarter look like? So well-being driven is the antithesis of silos and a one-eyed focus on reactive health and well-being. A complicated chart, forgive me, but I wanted to include this to try to share as much specific information as possible in order for you to understand what's the process that we go through in order to getting to this point where we can say and measure an organization as being well-being driven. On the left-hand side, you'll see right in the middle of the page there, a point I was alluding to earlier on. Consumers and employees, all of us, we're a little bit shrewd now. We're a wee bit more sophisticated. We understand what the CSR box ticking looks like. When an organization says we sponsor a particular sporting event, that's fantastic and a hugely positive thing to do, but it doesn't let that organization off the hook. And what that means that we do is we have, through our collection of what we refer to as our wise counsel, the ability to create wellbeing impact optimization programs. It's initially a 4-part module. The impact advisory board is there almost as that wellbeing champion, that frequent assessor, but also guide and supporter to review where you've been and where you should be going. Fractional chief wellbeing officers is something that we have as a network that we've just recently started piecing together. And actually that has come from people within the medical community who've raised their hands to say, there's no way that I can enter an organization full-time because I am a professional XYZ, but I'm more than happy to give up X number of hours or days, a month, a quarter, to be that chief wellbeing officer and overseer for an organization's leadership team that maybe aren't ready or prepared to fund someone in that full-time role, but who can benefit hugely from that expertise and insight. The Futures Innovation Lab is exactly what it says, but it looks at every single commercial challenge through a wellbeing behavioral lens. And We Are Humanity, selfishly, is one of the 3 examples we're going to come to in a short while that I hope can give you some flesh on the bones, as it were, when it comes to understanding what we mean by being wellbeing driven. Where does it start? It starts with some really simple questions. As a leadership team, you face a number of choices, and none of which are mutually exclusive, and none of which are wrong in terms of how you might answer. But understandably, depending upon what category you're in as a business, your size, your focus, your scale of success, or otherwise, you will inevitably have a different starting point from either a competitor or a very different shaped business. So whether you start looking at internal wellness, changing customer behavior in terms of the way that you serve them, or whether you believe your scale enables you to empower and enable improved health in the physical community in which you operate, none of those things are wrong, but all qualify in terms of wellbeing driven attributes. And the question on the right hand side may seem to come from a desire to be a bit of a troublemaker. It genuinely isn't, but it's questions such as that we lead with, because you'll be surprised how many people, when asked that question, really don't know how to answer, although they will have told us they're doing amazing things when it comes to well-being, either internally or externally. Insight, I mentioned, is a huge driving force, of course. This, I thought, was a really interesting point to include today from a very senior leading figure within Deloitte, who said that, of course, we're all used to surveys, but we are consistently surveying employees and consumers. That's great, but unless you are prepared to understand and take the leap into real-time data, or as dynamic a data set as you possibly can, you are inevitably only ever going to be responding to historic or aged challenges. You are not looking at what's happening today, and certainly have very little perspective on what it is that's going to be challenging and required when it comes to tomorrow. So we've developed, we refer to them as foundation roadmaps. The first is a deep dive into those attributes: brand, culture, behaviors, and environments. The second looks more closely at individuals and groups of individuals within an organization, or in a consumer brand group, if you wished. And that's the starting point for creating the map that takes you along that road of becoming well-being driven. And I say road because, without doubt, this isn't something that happens overnight, but you do know that each quarter, if a well-being driven impact is achieved, then the next quarter's impact will be exponential. So where does this lead us? Very, very quickly, I wanted to take you through 3 examples of where well-being driven strategy is either being applied, or where we are in discussions about how it might be applied. And I hope this gives you, as I say, some flesh on the bones. First of all, in the UK, but I'm sure not exclusively in the UK, by dint of pandemic, but also other economic pressures, the high street as a typical and regular shopping venue has changed forever. But bricks and mortar still remain. And what interests us, and the study that we did in 2022 with the Royal Throat, Nose and Ear Hospital, is part of the University College London Hospital Foundation Trust estate, and that they are our prime collaborators in this initiative. That taught us that there are opportunities to create well-being destinations. Going to the high street, if you speak to our children who are in their 20s, and if I talk to them about shopping, of course, first level shopping is always e-commerce. If there's a destination that they're going to, it is inevitably because there is an experience that can't be digitized. It's not simply to go somewhere to buy a physical item. And we know that the high street local businesses are craving reasons to bring people back to the centre of town. We think the city centre can become something of a health centre. And in fact, there's some really, really auspicious bodies and institutions looking at this in more detail right now. Financial services. Now, the reference here on the left takes you to a United Nations initiative. I won't go into a deep dive analysis of it now. Essentially, the United Nations Economic Programme for Finance very politely said to the global financial services and insurance sector, we think you need to do more. We think you should try harder. There is such an opportunity, not just from a data perspective, but in terms of products and services that can be shaped, that can teach us, that can aid us and support us to become healthier as a nation and as individuals. But also there are unmet needs that currently an insurance organization is perfectly well placed to serve, that are being horribly unmet. The insurance organization that we are collaborating with at the moment told us that, and this is where this initial piece of work came from, that during the course of the pandemic, not surprisingly, they had never had quite so many inquiries about health and life insurance. However, their conversion rate was significantly lower than expected. And when they spoke to their IFAs, their independent financial advisors, those advisors were saying, we're having long conversations with people who are actually asking questions that we aren't equipped to answer. The pandemic has taught us as individuals to be more sophisticated in our inquiry and more sophisticated in our expectations. And in many cases, that's falling short. And for the insurance sector, it's a massive, massive opportunity. Last example, something very close to our heart by dint of our association with University College London Institute for Women's Health. The more that we looked at employee wellbeing platforms, the more that we discovered not only are they, of course, reactive, understandably, but they are not meeting the needs of 21st century women. And if you look at what's happened since pre-pandemic, even men have raised their hands to say, listen, we understand that society is changing. There's more that we should be doing to be partners in that change. But women, however, certainly when you spoke to them directly and when you look at employee wellbeing platforms, are still regarded as the incidental part of a service structure. And in fact, it wasn't until 1993 that a law was passed to proactively include women in clinical trials. 1993, not 1893. And if you take the fact, again, UK specific, but we know that the UK population of working age is going to fall by over 40% in less than 20 years. Organizations have an opportunity to keep, retain, attract, and nurture the brightest of the bright, rather than letting them go. And our proposal under construction is something that hasn't been done before. It's a proactive whole of life wellbeing platform that is co-created by each employee, and each employee then has access to a global network of partners who can meet that unmet need that wasn't part of the original prescription when they first signed up to their health. I'm very conscious of time. I'm going to scoot on to the very last slide, only because if it's relevant and of interest to anybody, these, I think, are some of the references that might fuel your interest in terms of the link between organisation, employee wellbeing, and our perspective on what healthcare and health services should look like in the future. And that really is a wrap from me. Thank you very, very much for your time and letting me intrude on your day.
Thank you, Paul. That was absolutely brilliant and so nice to hear from you. And Paul and I are working on the Irresistible Business Index together, which we will make sure that when the recording goes out, we can add a link onto the bottom on that. This is really powerful stuff and really transformative for the workplace. Your piece on well-being. No, not at all. I just want to make sure I throw that in there at the end.
I have to raise my hand and say I've made a horrible error. There is one more slide. If you're able to share that slide, the link is in the slide when people get there. Absolutely.
Amazing.
Thank you again for your time today.
Thank you so much. Take care. Thank you.
Bye.